Now, between 50,000 and 100,000 women globally suffer or are affected by obstetric fistula. In Africa, it is said that almost 2 million women live with untreated obstetric fistula. And as Kenya joins the rest of the world in marking World Fistula Day today, the latest report by World Health Organization has it that 3 in every 4 women have a fistula. This estimates to about 300 births or 300 women in every 1,000 deliveries. Now, leaving about 7.5% of women who cannot access services for treating fistula. Now, on our discussion today on My Doctor Show, our topic of discussion is obstetric fistula, and we do have a very important guest in studio. We have Dr. Edward Sang to just help us understand what are the causes for fistula, how can it be prevented, and what are the treatment options there are for this condition. And we will also be having a representative from AMREF, and who will also be taking us through where they are or where we are in as a country in terms of awareness for this condition that is really leaving many women facing a lot of shame and also social segregation, and also with some health complications. As usual, you're welcome to be part of this show. Talk to us. Use the hashtag #MyDoctor on Twitter at Ebru TV Kenya or at Purity_Museo, and also call us live using the number that will be displayed right at the bottom of your screen. My name is Purity Museo, and for now I'll ask you to sit back, relax, and learn from this exciting show ahead. But first, let's have a look at some of the tips on ending fistula. Obstetric fistula is our topic of discussion today on My Doctor Show. Remember, the world marks the world, the world celebrates World Fistula Day today on the 23rd of May 2018. And in studio, we do have 2 important guests. First, we have an expert who is a gynecologist to just help us understand more on fistula. You're welcome to talk to us. Call us live. The number will always be displayed right at the bottom of your screen. We also have a representative from AMREF. Her name is Felicitas Mwoki, to just tell us where they are in terms of campaigning awareness and also ensuring that the areas, especially those in rural areas who have a fistula but now are going untreated, get those services. Help me welcome these 2 guests today. Next to me is Felicitas Mwoki, right?
Yes.
Yeah, welcome to My Doctor Show.
Thank you.
And we have Dr. Sang, Edward Sang from Mpisha Hospital. You are a gynecologist. Thank you so much for honoring us with your presence, Doc. Can we start with you, maybe just helping us understand what exactly fistula is?
Okay.
Yeah.
Okay, fistula of different types. The main one that people know or talk about is obstetric fistula, which occurs as a result of difficult childbirth, where medical care is not really available. So as was shown on the clip, somebody labors for days, 2 days, 3 days, even 5 days, which is too long. And especially the lady undergoes something called obstructed labor. So the baby is not coming out, it's too big for the birth canal. So the head of the baby presses on the soft tissues of the mother against the mother's pubic bone. And then that tissue, because of no blood supply, dies and forms a hole. And so the lady usually leaks urine. So that's what we call a fistula. That is from the bladder, so that she leaks urine. There are also other fistulas where the hole is with the rectum. So now she also leaks fecal material through the vagina. So those are the main ones. Other conditions can also cause fistula, but not as common as obstetric fistula.
And Felicitas, we've seen the last report on fistula cases in the country. The numbers are really high, especially in rural areas. So many people are living with fistula and they cannot access these services. First, just tell us, as we celebrate World Obstetric Fistula Day, do we have anything as a country to pride ourselves in? Have we made any steps regarding to ending this stigma-related condition?
Well, Purity, thank you so much for giving me this chance actually to talk with the public and actually create the awareness about it. Actually, I personally am a living testimony. I am a survivor, and if I can count, it's like 9 years, almost 10 years ago since then. And it is true. The number is actually growing, but AMREF has really stood on the gap. Because actually with the fistula, it's not a, it's not a sickness that can shock one. it is not a tree that is untreatable. It is a treatable condition, and it has solution. That's why actually today I'm here on 23rd of May, the year 2018, and I said I will never get tired actually of passing the information, because actually I being a victim and passed all those, recovered for years. Now to me it is an history, and history that I usually talk with a laughter. It's a solution, and we are here to, to encourage the other women that it is not actually a big deal. What actually I want to pass to them, let them come out. The solution. Hamred is standing on the gap, and then, the doctors are also actually willing, voluntarily doing the whole job.
Yeah, and you'll be telling us more about your journey with the fistula. But before then, Doc, maybe we could generally now have a look at different kinds for fistula, because from small research, it is also said that we have fistula in men. Is that right? Maybe we can talk about different kinds for fistula there are.
Yeah, there are different types, and a fistula is just an abnormal connection between two spaces. So the way there's a fecal fistula in women, it can also occur in men, usually because of various infections or injuries, unlike in women where it's mainly because of obstetric causes. Cancer also can cause fistulas. Treatments like radiotherapy can also, because of the high radiation, in some people it can cause a hole in some tissues. Yeah,
and we just encourage you to use the number that is displayed right at the bottom of your screen to talk to us. In studio we have Dr. Sang, who is helping us understand more on fistula, and more importantly how to treat and prevent ourselves from getting it. And also we do have Felicitas Mwoki from AMREF, and she also says she is a survivor. She'll be telling us how it is like to have the condition that comes with so much stigma. On Twitter at Ebru TV Kenya, at Purity_Museo, use the hashtag #MyDoctor. And Doc, other than for women, other than the obstructed labor, do we have other causes for fistula, like infections, the recurrent infections that we see for women? Or
well, it would have to be a severe infection. Fortunately, they are not common. Surgery, undergoing an operation, also sometimes can injure various tissues and cause a hole. As I said, radiation, cancers would be, but by far the majority is obstetric fistula because of childbirth.
Okay. Do we have symptoms? Maybe when one is in labor, are there signs that if I give birth normally it's going to be fistula? Or how can you tell that a woman will have fistula after delivery?
Well, it's just a lady who has not been managed well or looked after well in labor, because a labor should not take 3 days, 5 days. So these are usually ladies in places where they are not able to get to the hospital, or are trying to deliver at home, or they are not able to undergo cesarean section in good time, because this baby is too big and it's not going to come out. And as we heard on the clip, the baby would even usually die because of the prolonged labor and the stress on the baby. So a lady who has taken too long in labor, the baby has died, and then that one is at high risk of getting a fistula. So if they're able to get medical attention, would usually try and relieve the pressure by putting a catheter to drain the urine, so that the bladder can get time to heal. Of course, the prevention is to have good obstetric care. So a patient who is in labor can have a cesarean section in good time. Yeah.
All right, and Felicitas, you've told us that you are a survivor. Maybe you could tell us what exactly. Doc has talked about some of the symptoms, what exactly happens. Was it the same case for you? Did you maybe experience some obstructed labor, or what exactly happened?
Fantastic. Madam Purity, okay, just the way I've said, I'm a victim. I've experienced all that. And my case, it was actually what he has mentioned. It was the end of year 2008 when I was getting my second child. Whereby my first child I got her so nicely. There was no even operation. There wasn't even any slight cut. But when I was getting the second child, I thought everything will go normal. But neither did it even go that. So what happened? Okay, my child was big. I think she was 3.8 kgs. And according, the way they talk about it, you see, there are some kids you cannot actually give normally. I did not know that. I just went back to the same hospital that I delivered the first child, hoping everything would do, So to me, on my side, it was an obstetric, labor. My child was big compared to the first one was 2 point something. I did not even know whether it reaches somewhere you cannot even, you cannot give, birth normally. I did not have that, anything in my, in my mind. Neither was I even aware about fistula. In other words, I was not aware of any danger that might happen.
Right.
Actually, the first danger that a woman thinks when actually she's giving birth in death.
Yeah.
But, we usually forget other things like the minor ones. The death may not occur, but something else may occur.
Yeah.
So to me, actually, it occurred on the fistula that, I just went to the hospital where I was getting the second child. But I labored for because I started labored on 22nd at around 10 a.m. It went the whole day. It went the whole night. Then come
More
on
than 3 days.
Yes.
Yeah.
It was December actually. You can imagine it was during Christmas or towards Christmas. It all went again 23rd. It is when I was rushed to Kenyatta National Hospital for actually first aid. Because actually there was in difficulties and actually definitely you just the way the doctor said, you see the child is here, the head is protruding, but nothing can happen. You cannot go that. Even I remember even I started to swallow. My body was swallowing, so it was becoming swollen so much. So when I was taken to Kenyatta, in fact I just ended on the emergency side. But what I remember, and what I actually remember now, it is like almost 10 years. Okay, 9 years, and, just talk to come at 10 years.
Yeah.
So I just remember, let's save one life. So definitely, one of us, almost pronounced dead, or maybe you lose the two.
Yeah.
So there is a danger of death in the first place. So, hapo in the casualty, you never know what will happen then. Then from there, second to theater, the operation, I understand. See, I was laboring. Manzo, it was so nice. I didn't know whether something will happen. It took 1 to 3 hours, over 10 hours. Then from there, it went to an extent till that I was to be operated. Now, there is a very big risk there. In the first place, I didn't know whether there will be a, fistula kind of. I thought of death.
Yeah.
That is it. So when I was taken to the theater, the operation took so many hours. Because I remember it was from 8 a.m., time like 8, and it went up to 7 p.m.
Yeah.
You can imagine how serious it was.
Yeah.
So when I became conscious, it was around 8 p.m. It's when I actually opened my house. Actually, what happens after the theater, maybe we may not be having experience about it. So I was with my child, because actually what came to my mind actually was in the hospital, delivering. I was told, no, you're not aware. Mtoto wako alikufa. So I just went off again, and then I said, can I see more? Then I was shown my baby. Now, you could not feel yourself. You were like, everything, is put, or the catheters he is talking about, some pipes, that kind of experience.
Yeah.
So what I'm trying to say is this, that is Kenyatta. I've lost my child.
Yeah. You also have a condition.
I have a condition that I cannot even understand, that I came to understand it after 1 week, still in the hospital. It's when actually was, it was brought to attention that there is a fistula, and then you fall to be one of the victims.
Yeah, and maybe, Doc, it should be a painful affair, right? Maybe, Doc, you could just help us understand because the main cause for fistula for women is obstructed labor, as you say. What causes obstructed labor?
It's just disproportion, meaning the baby is too big for the pelvis.
Yeah.
And so the lady is trying to deliver, push, but the baby can't come out. It's just too big. And so a baby will only be able to stand that kind of labor for a short time. and so the baby would die after a while. Because during a contraction, the baby is not getting any blood. The blood is not circulating, so there's no oxygen getting to the baby. So after a while, the baby is not able to withstand it. So that situation...
After hours or after days?
No,
after days?
usually maybe a day or two.
Yeah.
So the baby will get more and more tired and then eventually die. So a situation like that is where a cesarean section should be done in good time. Because again, labor, there's a certain duration which is acceptable. The cervix should open up to 10 centimeters. It shouldn't, they say a lady should not, if a lady comes to the hospital, either the sun should not set or rise when she's not delivered. So if she comes in the daytime, morning should not reach, the next morning should not reach and she's not delivered.
Right.
Or if she comes at night, the next night should not come before she has delivered. You'll know it's taking too long.
Yeah.
And so an emergency, it becomes an emergency, and then the cesarean section should be done. What Felicitas is saying is maybe in the hospital she was in, they did not have facilities for cesarean section. So again, coming all the way, that's another loss of time. So if the cesarean section could be done in good time there, then it would be, that could have been prevented.
Yeah, and Doc, what are some of the factors? I know it all depends with the mother, but what are some of the factors that contribute or that makes the baby become too large for normal delivery? Maybe you could help us understand.
Well, at times even, of course, there are those who are diabetic and the babies are generally big. But there are some, her baby was not too big, 3.8 is still reasonable size. So there's just a disproportion. Even a lady can get a fistula with a 3-kilo baby or 2.5 when her pelvis is too small. So it just depends. And somebody may have a big baby, but the pelvis is also big and can deliver normal. So, but at least diabetes is the main problem that causes very big babies. Yeah. Diabetes
that causes big babies. So, Doc, what happens to women with fistula once you've had the obstructed labor, and at the end of the day you will have to lose your baby? So what happens exactly?
Well, the main problem is the leaking of urine. So there's a hole in the bladder through the vagina, because the vagina is just in front of the bladder is just in front of the vagina. And so when the head presses on the bladder, then that's where the hole is created. And then also the urine keeps leaking all the time. Of course, the smell is a problem, because you can imagine somebody who has urine on their clothes the whole day and the whole night, because they can't stop it. Of course, they could try and put diapers or cloths and things like that, but those will always have a smell. And as we heard on the clip, then it becomes a problem in the family. They can be ostracized. You can't go for a function or a meeting because everyone is very uncomfortable. And so it makes them outcasts in the community. And then life becomes really difficult for them.
Yeah. Mom, maybe I'll ask you, how was it like for you waking up and you find yourself with catheter, and in the first place you're saying that you didn't even know what it was? Did you get some explanations from the doctors? And also, how was the whole experience for you?
Well, to me, it was very tough. It was so shocking. And let me tell you, Purity, it is the worst experience I've ever had in my life, sincerely speaking, because it was so tough. Because actually, after I was moved from the theater room, those rooms after you are from the theater, then taken to the ward, and the ward when you are taken, you have the other mothers, they have their kids, and you don't have a child, and you have you have some cats. You also have some pipes that you cannot even understand. You realize that you cannot go to the toilet normally. You see now, so it is so hectic. It is so disgusting, it is so shocking, it is so hurting. And it really affected me actually when I was in ward, because it meant me to stay there for like, because I remember I told you that it was on, I was taken there on the 23rd, 24th in the month of December. That was that year. Then it took me till February, still there, because actually it affected me until that, you know, the cesarean, it again burst.
Yeah.
So when it was, you know, I was to be done again. I wasn't be taken there. When I'm actually in the ward, I'm just be taken to the, you know, the VVF clinic every Tuesday, whereby I could see actually the experience itself. Me, I ain't painful. The wound ain't not healed. I you know, I was affected. I've lost my baby. You can imagine a mother carrying a baby for 9 good months. That's almost a year. Then again, all those, you know, those things that you experience. Finally, you know the child. And then you are in a condition that you don't even know whether it will be treatable or what.
Not, yeah.
I'm telling you the truth, by then, it was actually not, it had not actually penetrated fully. And then to me, it was forever and ever.
Yeah.
But God is a living one.
Yeah.
Yeah.
And Doc, she's introduced something else, that, you know, you have fistula and at the end of the day you had a C-section. Kindly explain, like, how are you able to, because I understand the C-section is also done at the lower, at the abdomen. How do you cope up? And also, what are some of other complications that comes for patients with fistula, you know?
Well, like in a certain situations, even if the baby has died, at times you still have to do a cesarean section to remove the baby,
Yeah.
like Felistas. Again, infections can occur, the wound can have problems. So those are things we see. So also urine infections are common because the bladder is open, not closed as it's supposed to be. So again, getting infections all the time can occur.
Yeah. And someone may be asking, now when you're managing, not really managing, but when you're taking care of this woman with fistula, first, how does it even form, you know? After obstructed labor, you said, and the baby is not coming out. So does it just form because the baby is not coming out, or it's after the baby is forcefully, you know, forcefully comes out?
Okay.
Maybe you could make us
Yes.
understand. Yeah.
Actually, it's more of the pressure. So the baby is like stuck. Obstructed labor is like a stuck baby. So it has entered somewhere and it can't move. The mother cannot push it out and it's stuck. So the bladder is caught. It's like it's pressed on the bladder. Now the bladder now is not getting any blood supply. So it undergoes necrosis, or like it just dies. So that part which dies now is what opens up as forms a hole. So it's more of that obstruction itself, not being pulled out. So, and that obstruction would occur for, so maybe those 3-4 days, the baby is just stuck there, no movement at all, and the bladder is caught. So it would form a hole. Obstructed labor, if it can be, what we would try and do is put a catheter to try and avoid the bladder getting full. So the bladder is in a relaxed position, and so it might heal in some cases. You can actually prevent the fistula if you put the catheter after a lady has had obstructed labor.
Right.
But not all. Some would still get a fistula. So the problem occurred at that time of the obstruction. In some countries, they would still remove the baby. They can do what is called destructive delivery, where they can, the baby is already dead, so they can remove the baby in pieces so that they'd avoid, again, going for cesarean section. But that is a bit gross for some people.
Yeah.
So at times you'd still just prefer to do a cesarean section.
Yeah, that's right. And let's talk about the risk factors. Do we have risk factors for, because you're saying it's obstructed labor, are there risk factors apart from diabetes for fistula?
It's the location. So if it's in a hospital where cesarean section can be done, you'll not get a fistula. But there are parts of this country, for example, where cesarean section is not available. There are places where people have to take hours and hours to get to the hospital. There's no road, there's no transport. So imagine a lady who has to take 3 days to get to the hospital because she has to walk there or has to be carried on a bicycle. We've had the floods at this time, so people are cut off. So we don't get it in urban areas where obstetric care is good, where labor is managed well, but in the far-flung areas where ladies are having problems or trying to deliver at home, there's no doctor, there's no midwife, maybe just being helped by relatives. So those are the main problems. So it's a disease of the third world mainly, and a disease of areas where there is low socioeconomic status. So probably it's more of something which needs a lot of intervention to improve the healthcare of the community.
Yeah. And Ma'am, for you, maybe you could help us understand what the doc is saying. For you, was it the case why, as in the reason as to why you had an obstructed labor for too long? Was it because you're far away from the next medical facility, or what was exactly happening?
Fantastic, Purity. Now the thing is, actually the way I've said initially, I went back where I delivered my firstborn,
Yeah.
having all the, thoughts that all will be well.
Be okay.
Number one, wherever I had gone, there was no emergency facilities like CS, of course not. They were not there. Number two, I believed myself, with much confidence that everything will go well because the same nurse, the same doctor are attending Felicitas. You see, now believing yourself. Number two, I didn't know, to me, during my, prenatal, postnatal, whatever comes first, is in, there is a way you are devised. Your perfects are very small. They are very big. You can give normally. So to me, it was, I can summarize it like that. I didn't know. I believed myself. I not even have a second thought of going to, where I can get an emergency, which it came too late.
Yeah.
Yeah. That is where I can actually categorize myself.
Yeah.
Yeah, that's why it's failed.
Yeah. And Doc, are there ways that a woman can be doing, especially a pregnant woman, in terms of exercise, in terms of diet, that they can really be putting themselves into to just ensure that they avoid? Is there a way we can avoid getting obstructed labor?
Well, the main thing is probably just a facility where the healthcare is better. Of course, for those where the babies are big, for those who are diabetic, then they should be seen regularly so that the diabetes is well controlled. If the diabetes is well controlled, the baby won't be too big. Having said that, it's mainly probably some things out of the control of the client. In places like Tana River or coastal areas where the distances are too long, there's no roads and no transport, then that is probably out of the reach of, it's not something the lady herself can do. It's probably something that the community and the government can help, rather than the lady at times may not be able to do much on her own.
Yeah, and so when we come back, we will also be addressing some of the stigma that comes with fistula. Remember, it is World Fistula Day, and in studio we have Dr. Edward Sang to just help us understand what this condition is and how it can be prevented and treated. We'll also have Felicitas Mwoki, who is just telling us how it has been like, it was like for her, but now she is well. When we come back, that's the discussion we will be having, so do stay with us. Welcome back to this second and last part of my Doctor Show. In case you're joining us for the very first time, our topic of discussion today is obstetric fistula, and in studio to help us understand, we have Dr. Edward Sang, who is a gynecologist from Empisha Hospital, and we also have one special guest who is Felicitas Mwoki, just telling us how it is like to live with fistula. Just talk to us. The call line is displayed right at the bottom of your screen, or use the hashtag MyDoctor on Twitter at Ebru TV Kenya and at Purity_Museo. But just before we could continue with our discussion, as usual, let's get the home remedies. Yes, and once again, we welcome you to My Doctor Show. This is the last part of the show. Remember to call us live. Do you think even as we join the world in marking World Fistula Day, where are we as a country in terms of addressing even the stigma that come with that condition? In studio, we do have Dr. Edward Sang from Empisha Hospital, just helping us understand how can it be prevented. That is what we are discussing in this part. And also staying with us is Felicitas Mwoki, helping us understand that yes, you can go through this and it can be treated and it can be prevented. Talk to us at Ebru TV Kenya. On Twitter, use the hashtag MyDoctor or at Purity_Museo. And once again, welcome to the show. Yeah, we are on the very last part of the show, and Doc, we'll be doing our viewers injustice if we don't tell them how do we manage patients or people, let me call them women with fistula, you know. Mm-hmm.
Well, fortunately now there is a program in Kenya, in various parts, especially at Kenyatta Hospital, with Dr. Kisa and his team, where the ladies can be operated and the fistula can be corrected and the leakage would stop. So there are various camps which are held in various parts of the year and in various towns across Kenya. And most of the time, I think Felicitas will correct me, most of the time they don't pay.
There is nothing of pay,
Yeah,
even a single cent,
yeah.
even from biscuit fiber.
Yeah.
Mm-hmm. You
So,
don't.
so yeah, so this is sponsored, and so a lady can just go when the camps are there and then they're treated.
Yeah, and after the treatment, the surgery, you have your catheter on. After how long, Doc, do you get back to your normal functioning? And also, what can't you do at that particular point?
Well, the catheter is just kept there to allow the bladder to heal so that the bladder doesn't fill up with urine. Mm-hmm. So it's always in a relaxed position. So wherever the place which has been stitched can heal. Mm-hmm. So usually 2 weeks to a month, the catheter is kept in place, and then once it's removed, then everything should be back to normal. Yeah.
I'll come back to you once again and ask you, how long did you stay with the catheter? You told me you were in the hospital for 2 months. Did you stay in the hospital until the catheter was removed, or did you go home with it?
Purity, actually, thank you so much once more. And Purity, what I did actually after it was discovered in the hospital, remember I was healing from the CS wound. And then again, I came to understand, actually, you know, the fistula thing can even heal without operation. Yeah. Because actually my hole was actually when I come to realize about it, it was on upper abdomen. It was very, you know, when I was in the hospital, I was being taken for clinic. What was I was being examined. They were trying to see where the hole was, but unfortunately it could not be seen. So then from there, when actually I was in the ward, their nurses, Sister Kimonge, used to come in the, you know, on my bed. There are some exercises that you are supposed to do there, so that because actually they can contrast, then, you know, it stops.
Yeah.
Because to me, the hole could not be seen well, actually, where it was. So, number one, when the first step was done and there was no, you know, improvement. And then the time for being discharged from Kenyatta, it reached. So I was discharged, you know, I went back at home with the catheter. Because the solution for the fistula was not solved. And what was the main gist actually when I was admitted at Kenyatta. So I was discharged in the month of February. Then I was given an appointment to be coming for at Clinic 66 for checkups, as they were preparing to see how they can, you know, repair me.
Yeah.
I went home with the catheter.
Yeah.
So instead of the baby, I went with the catheter. I used to say it is a small baby.
And Felicitas, can I just cut you short just a little while? We have Shiko who is calling us. Can we hear what she has to say first? It's okay?
It's all right.
All right. Hello, Shiko.
Hello, how are you?
I'm okay. And you?
I'm also okay. I'm 2 months pregnant.
Okay.
And I'm concerned about yeast infection, which I alerted it to my clinician. And he told me that that's normal, although I'm a bit worried because as time goes by, I'm finding it sort of, it has some smell, and it's sort of related to the outcomes that you're talking about, the fistula side effects.
All right.
So, yeah.
Okay, go ahead.
I don't know what I'm supposed to do because I'm a bit concerned. Yes, it's 2 months pregnancy, but I need the right steps. And it's my first pregnancy. Also, I'm worried and concerned. So if you could advise me on how to go about it, or maybe the right place where I can seek medical attendance for this purpose.
Okay, Doc, do you have a question to her before we let her go?
No.
I'll
just be able
right.
to
I think she's concerned because you talked about also infections also being one of the causes for fistula. Should she be concerned about it?
No, okay. With yeast infection, it's common in pregnancy. And usually just with some simple treatments, it should clear. It's only that in pregnancy, it can keep recurring. But once she delivers, then it should clear. It doesn't have anything to do with fistula. It's actually quite a mild infection. So it's not that kind of infection that we were talking about. It's things like some STIs, for example, serious ones can cause fistula. Fortunately, we don't see them much. So for the collar, she would probably just need to have something we call pessaries to insert, and it should treat her very well.
Okay, thank you so much for the response. And getting back to fistula, Doc, once one has fistula, is she able to get her baby again after that?
Yeah, so once she heals, she can get a baby again. Only that this time, because of the history of the fistula, she may be asked to deliver by cesarean section to prevent it recurring again. Yeah.
Okay, and maybe Felicitas, you'd let us know whether did you have another baby after that for you, or you got scared completely?
To some extent, actually, I got scared. I went back to my doctor, Dr. Kista, who actually did it for me. Then I just saw some pieces of antivirus. Even before I went to him, I even go and did all the tests that you can even imagine a lady can do. I did, and then I went to him with an envelope. Doctor, this is it. Felicitas, why are you worried? There is nothing that has problem with you. So nikamwambia, then will I go back there? The doctors actually, they usually give you the utapona. So, of course I actually and I recovered. But that was my second child.
Yeah.
But in my life, I intended for 2. So the
So,
second one is, she went where she went.
yeah,
And I'm planning to get a child.
you're planning
Nothing
to.
that is hindering me. I'm
Okay.
okay. You're a proud woman.
Okay, and we are looking forward to having you get another child.
Thank you. I'll
Felicitas.
call her Purity.
Yeah, so much stigma that comes with fistula. You had earlier on talked of, a lot of some smell accompanying the whole situation. How do we address this? And also, Doc, once you have the catheter, are you able to walk around with it, or are you confined to staying at home?
No, you can actually walk around with it. You never know how many people are walking on the streets with catheters, because it's something for various conditions that somebody needs a catheter. For example, they may have a problem with the bladder. They may have had major surgery for cancer or something. So we leave the catheter again to let the bladder heal, because again, some operations can damage the bladder, and if you don't put a catheter, they can also get a fistula as a result of the surgery.
Yeah.
So a lady can function extremely well with a catheter. No issues. She can do all her work. She can go to the office. There'll be no, unless there's leakage, because of fistula, there should be no smell. But of course with fistula, because even with a catheter, there may still be a bit of urine leaking through the hole until it is repaired.
Yeah, and for that particular bag, is it usually one that you're given, or do you go? Is there a change of the bags? Because I'm very sure they're not available.
Oh yeah.
Really. Yeah.
Usually the bags they have a place you can open. So the lady is taught how to open. So once it's full, you just open it. So a few times every day, she would need to open and pour it and close it, then it fills up again. So usually we don't change the bags.
And I'll ask you something else, Doc, especially now you're using a catheter to pass your urine. What happens for a woman during her menses, as in?
No, she'll still have her periods,
Yeah.
because there's no connection. The catheter has gone through the urethra into the bladder, while the cervix is okay, the uterus is fine, so she'll still get her menstruation.
Because my concern was especially using the pads, and all that. Are you able? How do you fix?
It may be a bit
the whole-
uncomfortable,
Yeah.
but still there should not be any major problem. Yeah.
Okay, let's get a few challenges that you had to go through at home, staying with that catheter. What are some of the things that you could not completely do,
Fine. Actually, after I was discharged from hospital, there were some days that I was supposed to attend for clinic. I'm in the house. My child, by then she was less than, I think she was 6 years. My firstborn, that is Mercy. She was 6 years. She could not understand what is this. My husband, and huge of, lot of work. Because in the first place, you are advised to take plenty of water, plenty of liquids, maintain hygiene, and you cannot, bend and wash your clothes. You cannot do and this and this and this. But it was so challenging. Let me tell you, for Endam, because actually mine was done in the month of March, and March. And then in the month of June, I resumed it back to my office.
Yeah.
So during that time, I could not go to the other ladies, because it was actually, the Nairobians. Mama Mercy alikuwa na mzito, ilifanyika hivyo na mtoto alifariki, and then the other people want to know what next. Just the same thing applies to the village. So alipotea mtoto, then what next? You don't see her. So having that, I was actually enclosed in the house.
Yeah.
There is no far place I went. The farthest place I went was at Kenyatta, nikienda Ninino, when I was going for clinic.
Yeah.
The other place I went far. In fact, because the taxi could take me from the house, from Kenyatta to the house. And when I don't have money for tax, I was, boarding matatu. I remember one day when I was actually along outering, somebody hit me.
Yeah.
Because you cover it in a way that it cannot be seen, and again it is, the urine is flowing.
Yeah.
So I could not understand. But when I nikamwambia, akaki umeniumiza. enda huko kwani wewe ndio unaumia. I remember, so there are some frustration, people are not aware whether what you are going through, and most when you are born in the matatus, you cannot go to the other women, you cannot even do your own course. My husband did everything.
Yeah.
And again, something to hand on that. Just the way on the menstrual period, it is so hectic.
Yeah.
Because life has to control, to continue, and then body has to function, do its functions.
Yeah.
So it is there, it is hectic. You are there, you don't know where you to put it, the pants and so forth. I remember it. To me, it gave me headache. Yeah.
And Doc, I'll just ask you, because you've talked about the dangers that there are for anyone with fistula, and no one would really want to find themselves in such a condition. Do you think, as a country, we are doing enough in terms of awareness, especially on how to prevent, for women, how to prevent themselves from finding themselves in such situations?
I think the people doing fistula repair are really doing a great job. As far as the healthcare, we still have a long way to go to provide good, timely obstetric care to all citizens of this country.
Yeah.
So that is upon the local, the regional governments and the central government to find a way of the free maternity care did not help too much because now there was again too many patients in the government hospitals, so the care sort of went down, and we had other complications because of that. But a way where hospitals can be more widespread, specialists are available, then we can try and prevent the fistula.
Yeah, and also for the fistula repair, Doc, maybe you will just let us understand the cost effectiveness of this process. Can it be afforded by, you talked about the services are really free, is it the case?
Yes, exactly. Yeah.
Okay, so for people living in areas where they're not, the next health facility is thousands of kilometers away.
Yes.
How do we really ensure that they don't also find themselves in such situations?
I think it's trying to get healthcare down to the roots, to the peripheries, so that they're able to get a facility should not be too far away from any woman in this country. And then if they have fistula, again, from those places all the way to Nairobi might be quite a challenge, but the repairs can also be done locally. So most of the time they would go around to places where it's a bit near. They would advertise on radio and TV so that the patients can come.
Yeah, and also, Doc, you advise on for women who are pregnant, for example, you almost due, at what point should you now begin getting concerned and getting ready to go to the hospital? Should you go to the hospital when you're having the labor, or should you go maybe a few weeks prior to the delivery?
Of course, there should be the antenatal care at least once a month, so that the lady can be checked. We look for any complications that could arise. We keep checking the blood pressure, checking the baby's growing well. And then the most important is now when the labor starts is to be able to access the hospital in good time. And then at the hospital, we should have enough staff and facilities to be able to treat this lady. And should she need a cesarean section, that should be easily available. Usually it should not take more than 30 minutes, maximum 1 hour from the time the decision is made to do a cesarean section to be in theatre. So if it's a health center which is far, then that might be a problem.
Yeah, and Felicitas, you are now a champion, for this campaign on fistula. You are from AMREF Health Africa. Maybe you would now tell us what the partners are doing, the interventions by the partners, including AMREF, in terms of helping remedy the situation.
Fantastic. AMREF actually are really playing a very big and a very vital role. In the first place, they usually analyze, like weekly, like one thing, they have a camp in a certain area, they are able to approximate number of people and the most affected areas. So there are some people actually who are not in a country, they are not able to, to watch TVs, they organize for, radios, whereby, with vernacular radios, the other ones, the information is passed on.
And maybe because this is a national television and most people are watching from AMREF, from the research that you've been able to do, Felicitas, are you able to maybe inform the key health stakeholders, especially in the Ministry of Health, the areas that are really affected in the country right now, because the statistics are really growing, the numbers are really increasing. Which specific areas are really affected, by this condition?
Fantastic. Actually, areas like Kajiado, because actually they usually believe on their culture so much. The Kajiado and Coast provinces, and there is also at Machakos, there are also cases there, and most so actually the interior ones.
Yeah.
So that's why they have even come up with those radio, stations. They pass the information. They are working tirelessly to go to those camps. You find every day, every week there is a camp that is there. There is creation of awareness on the same. So you see most of the women are just popping out, because actually they usually believe it's a curse. It's all wrong, charms. You call it that, So we want to, they are really trying to show them this is not actually the culture, this is not actually the charms, this is actually the curse. It is a condition that can be prevented. It's a condition that can be treated.
But not a curse.
Yes, but it's not a curse. Yes.
And Doc, 7.5% of the Kenya's population right now, they are living with untreated fistula. Do we have any dangers to live, you have fistula and you're not seeking any treatment? What are the complications for that?
The worst would be infection, which can affect the bladder, and if it gets worse, it can actually go all the way to the kidneys, and that can be quite a serious infection. So, and also because maintaining hygiene is difficult, and having a hole open, infections can enter the bladder quite easily and cause problems.
And Doc, other than this particular fistula that is caused by obstructed labor, you mentioned earlier on that there are other types of fistula. Maybe do we have signals or symptoms, for that? Because if I'm not pregnant and I don't have any obstructed labor, what are other symptoms that when I see them expressed in my body, then I'll be like, I think I'm getting fistula,
Oh, it's mainly leakage.
Yeah.
Because an adult or a grown-up should be able to hold the urine and hold the stool. But if those are leaking without control, without the person able to control them, then that's a problem. So with the ladies suddenly leaking urine, you can't stop it coming out by itself. Then that needs to be checked.
And also for kids who really there are people who really take long before they stop bedwetting. Is it a signal for fistula, or what could be? Is there a relationship actually for that?
No, that is different. That is more of just a problem that most of the time will go away. Sometimes need some medication. If it takes too long, the child grows up and there are some medications or some treatment. So that is not related. Because that one, it's just that somebody has passed urine when they're not supposed to, because there's a problem with the brain controlling the urine function.
Yeah.
Which is common in babies and very young children, but as you grow up, the brain should be able to control that so that you can stay the whole night or wake up when you need to pass urine. But with fistula, it's actually that it's a physical hole that is allowing the urine to come out.
Yeah. And Felicitas, from your advocacy, do you think more need to be done? Where do you think is now the gap in terms of ensuring all women or all people with fistula get access to treatment?
In the first place, actually, I thank the First Lady, Margaret Kenyatta. She has really stood with us and in the gap of women. And actually, my plea is, if the government can really be actually ready to, not actually leaving to some organization, support the organization like AMREF, who actually seriously trying to fight against it. So if the government can actually assist the AMREF to fight the whole, it just
and of course other organizations that are involved in these campaigns,
which I know they are there, because according to my, you know, my research, AMREF is doing the volume, the big part of it. Sasa, if we can get the other organization in the support of the government, this disease can be fully and forever eradicated.
Yeah.
Just like you know that if I follow, you know, if I fall sick with malaria, I know there is treatment. I want us the sickness to be actually be understood like malaria treatment.
Yeah.
It's as simple as that. And then people stop fear, you know, like it's a shameful disease. It's not a disease, it's a condition. They need to know that it's a condition, but it's not a disease. It's something that is you can control. It's something that is treatable, you know, if you actually adhere what is supposed to be done and get fully support.
Yeah.
Like I personally, I have volunteered since 2009. I'll be ready. I'll fly all over. I talk with the, you know, anybody, you know, with the women.
Yeah.
Because if you engage the other women, you get much information.
Yeah.
Right now, actually, we are trying to organize some ladies. Even after treatment, there is also understand that there is a life after the treatment.
Yeah.
Not the matter of actually getting the treatment, then they. We are trying to, you know, try to see that after they get the treatment, we initiate some small, you know, businesses in a way that, you know, that can also, you know, get somebody who is hiding there.
Yeah, to just come out
to uplift
and,
them.
Yeah.
Yeah, at least to feel them appreciated.
Yeah.
Just the way I feel so much appreciated with the AMREF. I wouldn't mind
Yeah.
how far they tell me to go and talk to the ladies.
Yeah.
Yes.
And Doc, I'll also ask you, in regard to the same, there are so many people out there. You've already said that it's actually free. The services are really free. But now, when it comes to after getting the fistula repaired and you back home, then someone is asking what next. Do you think there is really good, you know, awareness or information when it comes to managing the patients, especially the caregivers for these patients? What do they need to do, you know?
After the repair, fortunately, things sort of settle down.
Yeah.
And the lady can go back to her life. And once the catheter is removed, she should be able to resume her normal activities. Before is where some of them may not be aware. The family may not be aware. And so I think when organizations like AMREF and others go out to spread the news and tell people about it, then those who may not know what they're suffering from can be able to access the treatment.
Yeah, and as even Kenya is celebrating, the world is celebrating World Fistula Day today, and I know there is so much report statistics that are going to come out, but as a doctor, I know you meet with these patients on your daily basis. What would you say, you know? I know we've made some steps in terms of especially making the cost treatment really free of charge, but getting those people, because the numbers for the people who are really living with the condition untreated is increasing. What is your one message to these people, you know, who have fistula and going through a lot of stigma? Should they come out, especially when they get fistula and they stay for too long? Do we have complications in terms of treating these patients, or is the treatment the same as the person whose fistula has been recognized and treated earlier?
Usually, fortunately, there's not too much problem even if they stay a bit long, except that now it would affect their activities. They may not be able to go out, meet friends, socialize. So, because at times, if the fistula is noted soon after delivery, at times the lady is given some time to see if that fistula might heal on its own, or for the tissues to, because if the operation is again done too quickly, it may not do very well. So you let the fistula stay for a bit, so that when the tissues which are not okay will clear off, so that now when you go and operate, those tissues are strong and healthy.
Yeah. And as you wind up, maybe your message to women out there, you know, you are a champion, you are a survivor. What's your message to women out there who are at home watching the show? They have the catheter on them. Others have not even gone for treatment because of the stigma. They don't even know the services are available. What's your one message to them?
One one message with my fellow women is that this condition is treatable. It has no impact. Because even from my experience, now there is a lady we met from Machakos. She stayed with it for 40 years. You can imagine 40 years. Then there is a smile after the repair. That's number one. You'll just heal psychologically. You'll be healed. And you'll continue your normal, lifestyle. Yeah. So my word is, make sure that actually when you are expected, go to a reasonable hospital whereby you can get emergency. As during our time, there was nothing about, fistula. We were not aware. There was not this awareness of this. Yeah. But what I'm trying to say that they are lucky. And we are ready there out to assist all this. Yeah. AMREF is there ready to, to haunt each and every, every woman who is suffering. And as I'm just talking, I hope I'm talking to a lady who knows somebody somewhere. Don't let your fellow lady suffer and you are watching us on the studio. When there is solution, there is nothing you're going to pay. You are provided with all facilities that are required there. You are supported from the beginning to the end. Yeah. And even after healing, there is solution and there is also support.
Yeah, Felista Smoky, Fistula champion. Thank you so much for making time for us. Thank you for coming to my doctor show and sharing your story with us. And Dr. Edward Sang, thank you so much for making time for us. We do appreciate. That's all the time we had for the show. And thank you all for watching. Thank you for your contribution. Remember, this discussion does not end here. Talk to us on Twitter at Ebru TV Kenya. Use the hashtag #MyDoctor and we will be forwarding your questions or your concerns to our special guest. But that's all the time we had. My Doctor Show continues next week. I'm Purity Museo. Do enjoy your time. God bless.